Some basic anatomy of the breast. Obviously there's the breast tissue, which is the yellow stuff, which is fatty tissue. Sorry, the yellow stuff's fatty tissue, the purple stuff's some glands in the breast. The glandular tissue is what changes when you get pregnant, so that increases and reduces the fat a little bit. As you put on weight, the fat increases, and then as time goes on, it sort of all changes. So as you get older, you lose the glandular tissue because all the hormones are changing, and you lose a bit of the fatty tissue and it gets changed to hard tissue, which is called fibrotic tissue. The muscle layer underneath that is the pectoralis muscle, which we'll talk in a bit more detail soon, and then there's obviously the ribs underneath that. Okay, so just some simple anatomy. What sort of incisions do we do? The most common one is the inframammary incision, which is the one just under the breast. Okay, that's what I like to use, that's what most surgeons like to use. It's the one that gives you a better result, gives you pretty easy access to the breast as well. The other one is around the areola, which is one I haven't routinely used, certainly is used a fair bit overseas. The only problem with that is it sort of tends to cut through all the breast tissue to get the actual implant into that field underneath where it sits. And then the final one's through the armpit, which could be useful, but again, it's a bit of a distance to get an implant from the armpit down onto the breast. Again, I haven't used any of the others. The main one I use and the only one I use is inframammary incision, and it's what the majority of plastic surgeons will use. It heals up really well. So these are the three placement options for implants. There's what we call a submuscular pocket. So this is under that pectoralis muscle that we were talking about before. And that's usually a good option for someone that might have let's say a breast reconstruction that needs to protect their implant to stop it dropping out, because you've got an added layer of muscle. Okay. The next one, which is the one I like to do, is what we call a dual plane. So it's half under the breast tissue and half under the muscle as well. And that tends to sit nicely, it tends to give you sort of a nice feeling implant, lets the breast drop a little bit as well. And it's a plane that a lot of surgeons use. The other common one that's also out there is just under the breast tissue. And again, this lets the breast implants move around a little bit more. They're not restricted, they can go up a little bit higher as well. And again, there's a choice of where you'd like to put it, and that can be discussed. I prefer the middle choice. But again, a lot of surgeons also perform the third choice. Most reconstructive surgeons will probably perform the first choice, and that's because of various options with where the implant sits and their other treatments.